Services, because there's no place like home.
Good morning and happy South Florida Saturday. Welcome once again to Limitless Health Horizons, right here on Legends 100.3. And Limitless Health Horizons is brought to you by Horizon Care Services. Excellence in private duty home care. And it's so true. There's no other company like Horizon Care Services when it comes to providing home health care and beyond. Like, there are so many more services. The breadth and the scope is massive. But the thing is, overall, the quality of care, and I'm thinking about this now, and the root of the word caring is care, right? The actual caring for the people that need the care, for their families, for employees, all of that comes from the top. To me, that's a leadership thing, right? You lead with heart, you're going to get that. And that is why I do love to be here with my friend Andrea Albertini, who is the founder and owner of Horizon Care Services. And it's a company like no other. You can learn more, 561-776-7757, 561-776-7757, or reach on out to horizoncareservices.com. It looks to me, Andrea, like it's a good day to wear white in the studio today, because I think all of us have that look going on.
I know, right? Unbelievable. Good morning, everybody. Thank you for joining us once again on our Saturday morning for Limitless Health Horizons.
It is wonderful to be here. And, it's been a little bit since because we've had so many stories and case studies and some specific examples lately. And I'd like to revisit for a minute what care is offered at Horizon Care Services, because there's a lot of things that set you apart as far as what you do. What makes it excellent as far as that private duty home care goes, Andrea?
Well, when I started Horizon Care Services 20 years ago,
20 years ago, by the way.
Yes,
that's impressive. I'm telling you.
20 year and a half.
20 and a half years, yes.
And I was a marketing liaison for a Medicare agency, and I went from hospital to hospitals, just basically setting up home care for the elderly.
Yes.
And I did everything: order the medical equipment, order the infusion if they required, the private duty, everything that you can imagine.
Right.
If they need a senior placement, anything and everything they needed, I connected them with. If they need an elder law attorney, if they need a physician to follow up at home when they get home, anything and everything. So I got to know this community very, very well and the needs of this community. And I wanted to make it a difference in our seniors' life.
Well, you certainly do that. And you used a key word a minute ago. And you said connections. And that's a big part of this. You have connections in the community with so many different businesses and caregivers and companies that provide the services that are the very best, but you also like to facilitate the proper connection between the caregiver and the person who's using the care and their families. In the end, Horizon Care Services ends up being kind of like this hub of connection with all these moving parts to bring them under one umbrella for the best care. Those connections in a lot of ways are your specialty.
It is, and that by taking all the responsibility from their loved ones.
Yes.
And handling everything. Oh. Everything ourselves.
And everything, because there are things we don't think about.
Everything. No, you don't.
And one of the key ones, we've talked about this a lot, but I'll never forget this when I was helping to take care of my mom on and off when she was having her issues. And my father was still alive, but I remember I'd visit them and just watching my dad, who was in his 80s at the time anyway, spending like 3 hours every Sunday night to get my mom's prescriptions ready for the week. Now, I could come in, I could do it in 20 minutes, but it would be watching that happen, and now knowing that there are people that can come and help with that medication management, to take that off because you're afraid you're going to get something wrong. If you're older and your vision's not what it was, this pill looks like this one. Can I read this label right? Was there a change to this? Trying to do it alone, you can't possibly do it. And so many of those eventualities we don't think about them until we're right there. But Horizon thinks of everything.
Absolutely. And actually, I got to tell you something interesting that happened a few weeks ago. We had a patient, male patient, that signed himself out against medical advice while the family is out of town.
Oh, boy.
Okay. Literally called the ambulance. and basically check himself out. Got
Wow.
wheeled out in the ambulance, came home with no hospital bed, no medication, no food, nothing. Absolutely nothing. Now, I don't know if a lot of you understand that if you sign yourself against medical advice, you come home with absolutely nothing because
Right.
they are not going to take responsibility for you leaving. So they're not going to give you anything. They're not going to give you prescription, order you any equipment, set up any care for you whatsoever. So this particular patient of ours had his own caregiver, of course. Our caregivers from Horizon Care Services.
Oh, yes, of course.
Thank God.
Yes.
So there was so many moving parts of this because now we had to call a mobile physician to come to the house
Right.
to prescribe the medication that our patient needed. Now we needed to order a hospital bed. We needed to order a commode.
Yep.
We needed to order diapers. We needed to order everything for this patient. Okay. Now the family's out of town. So the caregiver, so we basically had to use our own money for Horizon Care Services to be able to pay for all of those things.
Wow.
Because the daughter is the one who handles, this client.
Right.
So whatever we do for him, we pay, and then they just reimburse us for that. But can you imagine?
And there's another thing to add to that because I think this is a case that we've been talking about a bit, I believe, because this person, just based on what you're telling me, there's a cognitive issue here when you have someone who's going to sign themselves out like medical advice and then run into all those things you can't be prepared for, the stress that it creates on the family, and family is often so close anyway. We talked about it last week.
Yep.
If you're dealing with a parent and you're trying to tell your parent what to do, or a spouse who may have like owned a business for whatever, and if you're trying to give them advice or say, no, this is the way it should be, then their initial thought, and understandably so when you're dealing with cognitive issues, is, I changed your diaper. Who are you to tell me that? You know what I mean?
Sure.
It's that sense of, no, that's not the role we're supposed to be in. And it takes a kind of an authority figure, an outsider a lot of the time, one that they're comfortable with, one that is specifically chosen, one that has the quality that the caregivers at Horizon Care Services have to make that relationship happen, to step in and ease that dynamic. Because otherwise, I mean, it's an absolute havoc and everybody loses. Everybody loses
does.
in that situation.
Everybody does. And so we had to put a care manager
Yep.
in that case to be able to put all the pieces of the puzzle together.
And what a puzzle it is.
It is a puzzle. It really, really is. And a lot of people don't realize that. But it is a tremendous puzzle when you're dealing with that kind of thing with your family.
Oh, it's huge.
And it happens all the time
Of course.
in our business.
I get it. And that's part of the reason that, one of the biggest reasons of all, that you do need this help. If you have a loved one that needs care, if you have a loved one that they need the home care, maybe they need some of the other services like placement. We're going to get into that. And then if they're in the hospital or in a rehab facility, trust me, it takes someone who understands the inner workings of all of those things to make that a smooth process, and most importantly, beneficial to the person who's receiving the treatment, the one who needs the care. Because really, in the end, that's what it's all about.
It is.
It's about
It
that
is.
person who's getting the care. And if there are stressors around that, that's going to take away from the quality of that care. You can't do it on your own. And I have seen people try it over and over. When I was a financial advisor, I remember telling people, you can't do your own retirement work. You just
No,
can't.
you can't.
You can't know all this. But what you do at Horizon Care Services makes what I did, planning for a retirement like that, seem simple. There are so many more moving parts and a human
is.
factor in this, and possible things that could go wrong with a human body or a mind and this and that. You need to reach out to learn more. Call Horizon Care Services, 561-776-7757, 561-776-7757, or head on over to horizoncareservices.com. Now, we talk a lot about the things that set Horizon Care Services apart. And sort of related to that, I would like to welcome, you've got a new face at Horizon. There's a young lady who's in the studio with us right now. Her name is Lauren Clark, and Lauren is coming on board at Horizon, correct?
I am, yes.
Well, welcome, Lauren. It's great to see you here today.
Thank you.
And the white shirt's a great thought, and I like
yes.
and I like the heart that you're wearing around your neck.
Oh, thank you.
Well, that again, that says something to me, because knowing Andrea like I do, knowing what Horizon Care Services is like, having that heart is really so important. It's seeing the people you care for as human beings, seeing them as someone's mother or father, or in some cases son or daughter, right?
Absolutely.
As their spouse, seeing the human being that you're there to work with. And that heart alone, and the fact that you've been in this business for quite a while, says a lot about it. You've been around for about 7 years with your previous employer, right?
I was, yes.
And what brought you to Horizon Care Services?
Well, what connected me with Andrea.
Ooh, connected. I love it.
I loved her energy, and I loved her passion for wanting to help people and going beyond what other companies say they want to
so
do.
True, though.
Her passion is incredible. The way she talks about it, though, she wears her heart on her sleeve, and she's amazing. But before, I used to work in the hospital, and you realize there's care after the needs in the hospital, and with such a population with aging people and grandparents,
the silver tsunami, as we call it.
It is, and there's a lot of variables, and what sets her apart is the fact that she goes above and beyond for the community. The concierge. I've never met anybody who's had a company or a company that offers everything from scheduling doctor's appointments to actually caring for the patient. And it's not just caring, it's doing above and beyond. And Andrea and her company, they care. There's absolute, without a question, you can feel it. And it just drew me to her, and I loved it.
I love it. And look at the smile she has going right now.
I know.
She's a beautiful young lady.
I know.
And, wow, more beautiful than that. Andrea wears her heart on her sleeve, and you wear yours around your neck. Which,
yes, I do.
but to me, that what you just said speaks so much to why you've been around for 20 years with the same caregiver, 60% of them still with you since day one.
Yep.
You can see why, because it is that hard. And look, I've known you since before Legends was a thing. I've known you for quite a number of years. And it was that same kind of a thing. I think that when we first met at that coffee shop, just two strangers like, hey, how are you? There was something to that same kind of a light, right? You can see it in each other.
It was.
And that kind of a light, that kind of a care really is what Andrea, Horizon Care Services brings to every case and every human being involved in those cases. So much of it is about human dignity. So much of it is about maintaining the family relationships and making sure that people have exactly what they need. Not just, and it sounds like a cliche, but it's so true, not just to survive, but to thrive.
Yeah, absolutely. The fact that you need a caregiver, or you need somebody to manage your medication, or you need somebody to manage your health care, doesn't mean that life is over. It just means that you have a better quality of life with help.
Absolutely
at this
true.
point,
Absolutely.
And again, I remember, I think I've told you before that when my mom, we brought some nurses in for her, they ended up being friends in some really deep and special ways. I'll never forget how happy my mom and her nurse, they would watch Magnum, and they would both they would love the show. They'd talk about it the next day. They had their appointment TV viewing or this or that, and they had a really caring, practically a mother and daughter relationship. And my siblings and I were so grateful to see it, because my mom was just a very generous, very loving, kind person.
Well, she was a nurse.
She was a nurse. She was a charge nurse at Gardens Hospital for many years. And that's exactly it. She understood that manner. She understood those relationships. And knowing that kind of care is available when the right person is in that situation, it helped all of my siblings and me to breathe a sigh of relief. And just seeing how happy my mom was to have this new friend in her life was really powerful. And that's what Horizon Care Services offers. So head on over, horizoncareservices.com or 561-776-7757. Now, you mentioned something at the very beginning of the show that I think is an important thing. It's something you've been focusing a bit more on lately just because there's been a big demand for this kind of thing. And that's care placement, elder care placement. There are people who the facilities are necessary or sometimes it's just something they would prefer. There's a lot of different reasons why someone would choose an elder care facility. But there are, look around us right here in Palm Beach County. There are a slew of them, helping someone to find the right one, whatever the facility may be, or whatever the needs are, is really big. That makes a huge difference between surviving and thriving. So let's talk a bit about the elder care placement.
So I opened a company called Elder Care Finders.
Yes.
So it's eldercarefinders.com.
Eldercarefinders.com.
It is a free services to the community. So basically there are people who do very well at home with the private aid.
Yes.
Okay, such as your mom and
Yeah,
such as
great.
my loved ones that, right now using my own services at my house.
Yes.
But also there are others who likes to be on a resort setting. They like to socialize. They like to be able to go out to dinner or go out to lunch or go out to breakfast and meet other people.
Yeah.
So not everybody is a candidate for assisted living and not everybody's a candidate for home care.
Sure. It's individual,
Okay?
which I think
It's
is a key thing here.
Exactly. So I decided to be able, we were getting a lot of phone calls, with children who were like lost. They didn't know what to do.
Right.
I don't know if I keep my mom at home with private duty. I don't know if I put my mom in a facility. It's like the call I got last night from California. The daughter's in California.
California?
Yep. Mom is here. We take calls at Horizon. We take calls 24 hours a day.
Right.
But I had the on-call phone last night, so I took the call. So it was a daughter who is in California, and the mother is living with her daughter-in-law over here in Florida in Wellington.
Okay.
And she has the daughter-in-law have children. She's busy, and so the mother is very active, but she's very lonely, and she needs some help. So she doesn't know, should I place my mom on a facility? Should I order caregiving services? So we are able to be that one-stop shop where we're here to help you.
That's it.
To guide you. Because she was just completely lost.
Of course.
So I ask a lot of questions.
You have to.
Tell me a little bit about your mom.
Sure.
Let me get to know
And
mom.
wow, what a place to start it. Tell me about your mom. Let me get to know this human being. Let me get to know this person. Let me get to know what her likes or dislikes are. What kind of a person is she? Because you want to make sure that the place or the person that you're going to be working with, whether at home or placement, is going to be one that is right for them. And you can't do that by, I used to see people that would come out when I was, again, I'm going to take back the financial advisor thing for a minute. People would say, this is the product I'm selling. How can I talk to this person and shape their needs to fit this product? No, that's not the way that you're doing this. Mm-hmm. You're saying this is this human being with these specific wants and needs and passions and loves and feelings and desires and health issues, whatever it is. How can I, from this universe of places, find the one that fits her?
Exactly.
Instead of the other way around.
Exactly.
And that shouldn't be something mind-blowing, but it is in today's world.
It is because, Mike, here's the other problem.
What's that?
You have facilities. They're not all inclusive.
That's true.
So they have to pay for extra meals.
Right.
They have to pay for laundry. They have to pay for everything, for medication reminder. So you have to understand
Nickel
something.
and diming in so many ways.
So you $5,000 a month can become a $9,000 a month and $8,000 a month. So if you have a budget for your life, you can run out of money, and then what?
Very easily.
And then what happens? They're going to kick you out.
Yeah.
So it is very important, that I guide those families to say, okay, what's your budget? And okay, what is your longevity of your life going to be health-wise?
Right. What are the conditions?
What is the
and all
condition?
that,
And how much money what we're talking about that we can disperse per month for your mom's care or for your father's care. There's a lot that's entailed that sometimes people don't think about it.
I would think It's amazing. Wait, they want to do extra laundry and there's a charge for that? What?
That's what
that
I'm
would
trying to-
never occur to
Right.
me. And I like to think I'm a somewhat intelligent guy. And that is, it's so far outside of my bailiwick, but it's
You
your
never knew about
specialty.
that, see?
It never occurred to me. And there are so
Right.
many things that just don't. But those are the things that build up. There's the old cliche about bleeding to death through 1,000 tiny cuts.
Yeah.
Well, that can bleed your finances dry through 1,000 little leaks to the plan.
Yeah, so we have an incredible computer program with all the assisted livings all over the country.
Wow.
And it has where they charge extra for, everything, rates, everything. So when we get that client, we put the client into this computer with all their information, and then the best facilities will pop out.
Wow.
And then we call the client back and say, listen, we have 3 facilities that we'd like to talk to you about. And we actually go pick them up and take them so they can take a tour, they can meet other residents. So it's just a really nice service. We don't just give you a name of a facility. We help you. So also if that person needs to sell their home, we have a lot of real estate agents that we work with, and we help them sell their home. We help them auction their items if they want to do that. Wow. If they want to donate, who to donate to, a hospice or a hospital thrift shop or Goodwill. You tell us what to do. We provide everything from the truck to move the client into assisted living, to have our caregiver go with them for the first week, to organize their closet, organize their little apartment, get everything done and get them comfortable enough to be happy in their little resort life.
I should just take that and put some of these things you said tonight on a loop. Because, but I mean, I think, again, Laura, you talked about her passion.
Yes.
Your passion just in explaining that. And also your very justified pride in the job you do.
Oh, I love it. If you say to me, Andrea, if I was a genie and I could just wing my wand
Yep.
and say, what would you like to do when you grow up? I would say exactly what I'm doing now.
Isn't
so
that
I'm
funny?
a very lucky person. Really, I am.
And it's funny because my life's kind of the same way. Like if I
Yeah.
could say, look, what could I do? It's this.
Yeah, I love it.
And but that comes when you are allowed to live your passion. That comes when you are living something from your heart. It's a calling.
It's a calling.
I mean, this is not just like, this sounds like it's a good idea. There are people who get into it for that, or, hey, it's a good way to make some money. And it is, yes. But
It is.
But it's like, none of that has meaning.
No.
It's so funny. You help the people that are using the care, whether it's in-home or helping to find a facility. You help them to find meaning.
Yes.
And the fulfillment of that gives you meaning. And you find your meaning in that. And then I look over at Lauren, and she had that same kind of a passion for this, that same kind of fulfillment that she gets from having it done right, knowing that she's a part of an organization that does it right. And your services, I mean, we've talked about this before when it comes to getting everything done in one area. Yeah, you've got the placement, you've got the in-home, but we also, I remember we talked about cases where there were people in the hospital, and I mean, that's a complicated enough scenario at best, if you don't have a pro there who can coordinate with the nursing staff, who can, make sure that everything is getting done properly and right. Because everybody's insanely overworked at a hospital right now. Things are going to fall through the cracks. The crime shows where they're trying to solve the crime and they've got that board up with all the strings that are pinned everywhere. Mm-hmm. That's like a pretty good setup of a typical hospital chart with just one, where there's all these different connecting threads. And are they on this medication? What about this? Is this happening this? Does the doctor know about this? Does the nurse know about this? Overwhelming for a human being who is especially there with a loved one they're concerned about. You bring somebody in from Horizon who can help to navigate that. Nurse navigation, in fact, is what it's called.
Yes, our Nurse Navigator program. It is very, very, very important because the amount of malpractice, the amount of lack of communication, short staff in our health system today is terrible.
Yeah.
It's terrible.
Yeah.
I mean, if it wasn't for my loved ones having 24-hour caregiver doing this last 3 months, because he was in a hospital for like a month and a half.
Yeah.
Going from one hospital to a step-down hospital to a nursing home. I mean, if I didn't have an aide there with him 24 hours a day,
Not even possible.
It would have been horrible.
Yeah.
And it's not the hospital's fault, the facility's fault. It's just because people are not going to nursing as much anymore.
Right.
And even like in Palm Beach County right now, in Broward County, there's a shortage of primary care physicians.
Massive shortage.
It's unbelievable.
Yeah.
And then you have physicians who are not taking patients because they can't handle the quantity of patients that they have at the moment.
That's true too, yeah.
So we are having a little bit of problem in our healthcare industry, especially in Florida. I don't know anywhere, in other states, but that's what it's going on with us right now.
It is.
And in order for you to have the appropriate care, you need to be a concierge patient that you can just call your doctor directly on a cell phone and say, I don't feel good, this is what's going on with me. Otherwise, you're calling an answering service. Yeah. You are leaving message at the receptionist desk. Do you know if that doctor's going to get that message or not? No. Most of the
never
time,
know.
No.
And that's really, it sets you apart so much because it comes from the heart. I know that you're incredibly responsive, you personally, as well as Horizon Care Services. And that's what it comes down to. Responsive when you reach out, responsive to your needs, your desires, the desires and needs of your loved ones, all from the heart. Whether it's in-home care, whether it's nurse navigation, whether it is Elder Care Finders, and check out Elder Care Finders if you need them. It's a wonderful service, and it is a free service. Once again, you're not going to find another one like it. Horizon Care Services is the answer to this when you need this type of care for your loved ones. HorizonCareServices.com, HorizonCareServices.com, or 561-776-7757. Lauren, welcome to our happy little family here.
Thank you. It's been wonderful.
We're looking forward to seeing you more here on this radio show as well.
Absolutely. I look forward to it as well.
Yeah, she's going to be coming in the radio and talking about her experiences out there.
Wonderful.
Yeah.
Well, look forward to hearing and learning from them.
Yes, I appreciate it.
And Andrea, as always, thank you so much for everything that you do. And, I know that, again, there's so much to do for every patient out there, but Horizon is able to cover pretty much all of it. So reach out to HorizonCareServices.com. It is so comprehensive and so real. 561-776-7757. Limitless Health Horizons on a South Florida Saturday morning. Stick around. Lots more legendary programming on the way.
Horizon Care Services, because there's no place like home.